And as reported, the king originally went to the hospital to treat his prostate, and new research indicates that men could reduce their risk of getting prostate cancer by improving their fitness.
UW Health's Dr. Jeff Pothof is here for his weekly visit, and we certainly cannot speculate on what the cancer the king is being treated for now, but we can talk about his prostate health. So that's what we're going to do.
Sure.
Okay, so I want to make sure I get this right. The researchers say those whose fitness had improved by just 3% or more a year were 35% less likely
to go on to get prostate cancer. So not super surprising. So physical fitness has been shown in lots of studies to reduce the risk of lots of different cancers, but we haven't had studies specifically looking at prostate cancer. And this study looked at about 57,000 males, and they would have their fitness assessed using something called VO2 max, and they had it measured at least 2 times in about a 7-year period. And if you had an increase of 3%, so i.e. as you got older, you maintained or improved your physical fitness, it appears there's at least this association with a 35% reduction in getting diagnosed with prostate cancer compared to those who had fitness that decreased.
Interesting. How common is prostate cancer in men?
It's common in the sense that many men, as they get older, will get prostate cancer. The more important question is probably of those men who get prostate cancer, how many does it actually kill? If you're diagnosed with prostate cancer and you're now 88 years old, it's usually a slow-moving cancer. Some can be aggressive. It's very likely that you'll pass away of other causes before prostate cancer gets you. But it is important, especially if you're younger, to make sure that if you have prostate cancer, that it's being followed appropriately and treated appropriately. Very low-grade prostate cancer, sometimes we just watch that, make sure they're not getting worse. High-grade prostate cancers treated much more aggressively.
When should men start getting regular prostate exams?
Yeah, it's a good question. So the United States Preventative Task Force suggests that men start getting screened for prostate cancer around age 55. Some other guidelines will have a little bit different dates. That's typically done with a digital rectal examination and a PSA, so a blood test that looks for prostate-specific antigen. There's different levels of what's okay based on age. If you're a little bit high, maybe they'll do some additional work. If your prostate PSA levels are normal or where they're supposed to be, you're probably good for a few more years.
And in terms of the fitness, sometimes you have to be careful if you're a long-distance biker, if you're a man, right?
Yeah, there is this thing. So let's say you're going to go in for your PSA screening. One of the things that you want to avoid is any kind of trauma to the prostate that would then artificially raise the PSA level. So if you are like a biker and you go on, a 100-mile bike ride, and the next day you've got a test for PSA, well, that level is going to be really high. It has nothing to do with cancer. It just has to do with you biking for that long. So, talk to your doctor where you're going in for screening before you get your PSA test, just to make sure you don't inadvertently elevate it prior to the test for a reason that wouldn't be related to cancer.
Can you talk about what news of a figure such as King Charles, actually telling people, I've got XYZ.
Yeah.
What does it do to everybody else that hears this?
Yeah, I think there's pros and cons. So I think there is something good to be said for transparency in the sense that you draw awareness to something that sometimes people don't really want to talk about. Maybe they're ashamed to get things done. And someone who's maybe experiencing the disease who then goes on to say, hey, screening or things for that around cancer are a good idea, that probably resonates with people. I think at the same time, lack of specificity causes lots of speculation. I think everyone's trying to figure out what kind of cancer this could be, and really it could be anything. There's really nothing that helps us narrow down what this could be at this point. So we'll just need to wait and see until a time and a place that maybe they're ready to talk about it, and if they're not, that's fine too.
But treatment, there's a lot of encouraging news on treatment for prostate cancer, isn't there?
Yeah, I mean, for like we talked about, for many people, they won't need treatment. We'll watchful waiting, but there is a lot of treatment out there. It used to be we would just do radical prostatectomy, but now we've got androgen deprivation therapies. We've got brachytherapy, where you kind of implant seeds that kill the cancer. There's just so many things that we can do nowadays for prostate cancer. So important to get screened. No one wants to have prostate cancer. If you happen to get it, there are things that doctors can do to treat you.
That's encouraging to hear.
Thank you very much.
Thanks,
for
Dr.
your time.
Pothof. Good to see you.
We're back after this.